The Connecticut Hospital Association and the Connecticut Department of Public Health are pleased to present the 2024 Connecticut Hospital Community Service Award to Norwalk Hospital for its community psychiatric outreach program.
Individuals who are living outside or are homeless and in need of housing have neglected their health for years. Many of them don't have a doctor, they don't have any mental health or substance use services. And so our outreach is a starting point to connect with them, to start thinking about the services that are available and to getting connected into the service system.
And we really wanted a very easy, no barriers access to people who wouldn't usually get access to psychiatric services. So something different than our traditional mental health, make an appointment and come in.
This is sort of the environment that we sort of have created, but to be able to go into a person's own environment, we get to see who they are as a person, what sort of factors are contributing to their own sort of challenges. And in that way, we're able to better assess what we can do to help because we get to know the person on their level.
And there are people who, for whatever reason, are not ready to come to our offices, but they are ready to talk to you when you come to them. We see the reality of their environment and their lives. So we're able to hopefully engage them in more consistent treatment for their mental illnesses.
For a lot of people, it's difficult to come in. I have many people living out in the woods and not really familiar, or interested in necessarily talking to a doctor, but they were able to, put themselves out there and really, talk through some of the challenges that they have.
And so it's community providers having those conversations with me. Who are our at-risk folks in our community? But there are no forms. There are no assessments. There's no questions they need to answer. It's just us scheduling them, having those conversations about what people's needs are, and then being able to go out and see them and meet those needs.
I'll sort of meet people that are experiencing, certain struggles and challenges that they're going through, and to be able to help them and to really, connect them with the resources that they need.
There is a system in Connecticut that utilizes housing vouchers. And one of the important steps of that is called a verification of homelessness. And it's a form that needs to be filled out that you verify if somebody has some type of disability. A lot of our folks don't regularly see mental health providers, maybe don't even regularly see a primary care doctor that's willing to fill out that form. So they need a diagnosis. So it's very hard for our housing folks to access that and access it timely. So we are very happy to be a part of that process. With that evaluation from the psychiatrist, they're able to get the verification form signed off with a license number and submitted to housing.
Well, we've gotten people housed. That's the best part. That's what we shoot for here at the shelter. It's because of this interaction. We'll have gotten somebody from the streets or from the woods into an apartment.
It's up to us as professionals to take away those barriers, not to create more barriers.
People are now freer and more able to accept mental health care. And hopefully it will make a difference. Hopefully it will make a difference in people that are more satisfied with their lives so that they can be more productive.
You don't know how bad it is for people until you go out there and you see the conditions that they're living in and have just kind of resigned themselves to this is as good as it's going to get. Without that connection between the outreach team, getting people to this point and making the connection with Norwalk Hospital, they might still remain outside in the woods.
It reminds me why I went into medicine in the first place, to be able to serve those who are in need of care. For us, or for me, and for the team, it's deeply satisfying.
I'm very blessed. I'm very lucky. My position has been that I get to work with wonderful providers in the community on a daily basis, and I'm always at awe with the work that they do. But I'm also very happy that New Vance Health sees the importance of that work and the importance of partnering with our community organizations. And I am optimistic and excited that we can continue to grow those partnerships and continue to really take care of the most vulnerable in our community, because we can only do it together.